Hi, my name is Natasha Kashito. I'm a Sickle Cell Warrior as well as an advocate. So I'm very passionate about sickle cell because I am living with it. I am 32 years old and counting. And I'm here to share my story with you. I have a few questions here with me that I will be answering today. Hopefully you can understand me and sickle cell better. So question 1 talks about my early experiences. So it says, can you share your earliest memory related to your sickle cell diagnosis? How did it impact your childhood? And how did your family explain sickle cell disease to you when you were young? Wow. I don't really remember how my family told me about sickle cell, but I think they tried as much as they could to try and explain it to me. Of course, at a young age, it's difficult to grasp some concept about, you still don't understand life, and even though they explain to you what happens, you really don't understand what it is. So I would say it was just one of those things where I knew that I was sick and I was different from other children. And I spent most of my childhood in hospitals, in and out of hospitals. My grandmother can attest to that. I missed a lot of school, a lot of school. And I didn't have that many friends growing up because I never really had time to socialize. Between catching up with school and being in hospital, it was just a bit too much. So maybe I'd have 1 or 2 friends, but it wasn't really, I never really had that many friends. So, yeah, that's my early childhood. And the next question is talking about my daily life. So what does a typical day look like for you? How do you manage your symptoms and treatment? Are there any specific routines or habits that you found particularly helpful in managing your condition? Well, for me now, I would say I'm managing my condition quite well because I haven't had a sickle cell crisis in, I think, over 4 years. So it's been a good number of years for me. I usually just, like in cold weather, I'll keep warm and I'll always stay hydrated. I always take my medication. The only medication I take right now is folic acid every single day. And I used to be on hydroxyurea. It helps manage sickle cell symptoms and manage sickle cell crises. But I only take those when I'm in a crisis, and when I'm not, I stop taking it. So, yeah. And my grandparents are very big on food, and so they always make sure that I have fruits and vegetables and just make sure that I'm eating the right stuff. And I don't really have a daily routine for how I manage myself. I just know there are days when I wake up and I feel a little tired than usual, or I have body aches and I know to take my painkillers and rest a lot. And sometimes that means missing work, just take a day off and just spending time just resting and not doing much. So I'd say those are some of the routines or habits that I do. The next question talks about education and career. Wow, this is a big one. How has sickle cell disease influenced your educational journey and career choices? Have you ever had to make significant life changes or career adjustments due to your health? Can you share an example? As I mentioned earlier, I spent most of my life in hospital, especially between, first grade and I would say grade 10-ish is when it was really, really bad, especially primary school. High school started getting a little bit better, but primary school was really bad. I was always out of school. Like I would even spend a month away from school. So it required me to have personal tutors and personal lessons at home, just trying to catch up. But for me, I think right now I am a clinical officer. I just finished actually. last year, June, and I haven't yet started practicing. But I've always wanted to be a doctor or work in the medical field because I felt like I needed to give myself to fighting sickle cell, not just as an advocate, but also from the health point of view. So definitely being in and out of hospital influenced my career choices. And I know that my journey doesn't end here. I'm still carrying on. I still want to further my studies. So that's really something that I'm really excited and looking forward to. And the next question talks about my social interactions. How has sickle cell disease affected your social life and relationships with friends and family? Have you ever faced any misconceptions or stigma about your condition? How do you handle those situations? Okay. Sickle cell disease has definitely affected my social life. Especially when I was much younger. I didn't have that many friends because of always missing school. I wasn't really allowed to go outside and play with my friends because my grandparents are just very protective and were like, anything will trigger a crisis. So I was always just kept in the house away from people. So I think that kind of made me closed up and antisocial. So it's just during my high school years when my mother took me to boarding school and she left me there by myself. This was a whole new experience for me, being away from home. And it was quite interesting for me. It was, I didn't really finish the year. I had to go back home because I got sick, I think in the second term. So I went back home and I just became a day scholar. But that experience changed my life because now I was in an environment where it was just me and my peers, and there was no mom, dad, and everybody else who was just there pampering me and making sure that, are you okay? Don't do this, don't do that. So now it was more like I was living life on my own terms. So it changed a lot for me. And I feel like I started to open up a bit more. And I shared about my sickle cell story with my roommates because they needed to know, because they needed to know when I got sick what they needed to do. I needed to tell them about my medication and all of that stuff. So I needed to tell somebody. But I think for me, that was the experience that changed my social life forever. And when I started to do research for myself about sickle cell disease, and I started speaking more about it, I found myself to be more and more confident and more social and interactive with other people. So, I mean, even now, I still have those traits of I'm closed up and I don't really like to socialize and keep to myself. But I would definitely say that it's much better now than it was before. I'm much more outgoing than I was before. And have you faced any misconceptions or stigma? I have faced a lot of misconceptions and stigma. I remember one time in primary school, we used to share like lunch as friends, where you're a group of friends, maybe 5 friends, and you bring food and you share together. I remember this one time, one of my friends came to me and said, my mom said I can't eat with you because I'm going to get sick because you're sick. And it didn't make sense to me then what this person meant by, okay, so I went home crying and I said, my friends don't want to eat with me anymore because they're scared that I'll make them sick. So that is a misconception and stigma all in one, because sickle cell is not contagious. It's actually inherited from both parents have to carry the sickle cell gene in order for it to be passed down. So for me, I didn't really understand also at that age to say, oh, they can't get sick just by being in close contact with me. I just ran home and said, my friends want to play with me because I'll get them sick. And for me, it was a really confusing, difficult situation. But like when I grew up and understood what it is, I I actually forgave my friends. Actually, after years passed, I brought it up. I said, do you remember when this grade, you said this and this to me? And my friend was like, I'm really sorry for that. And I explained to her what sickle cell was. So now I'm in a better place to explain to these people who had misconceptions or stigma around it. It's because they were speaking from a point of ignorance and not knowing what sickle cell is. And the next question is about my healthcare experience. Can you describe a particularly challenging or memorable experience with the healthcare system? What advice would you give to other patients when advocating for their health needs? This one is really a big one because sickle cell warriors are facing a lot of hate or are being called names, rather, especially adult sickle cell patients. In pediatrics, it's a bit better, but as an adult warrior, the healthcare system is not as supportive as it is in pediatrics. One thing that is really sad is the fact that sickle cell warriors are labeled as drug addicts, addicted to opioids, painkillers. The truth is, most of these pain medications are very addictive. They have the power to get someone addicted, and I understand where the health practitioners are cautious about giving these pain meds in excess, but labeling someone as an addict is uncalled for. I remember one time I was in a very, very severe crisis. So for me, it usually starts in my legs and then it works its way up to my back. And sometimes it affects my chest, but normally it will start in my legs. So I remember this time it reached my back. And when it reaches my back, then I know that I'm like in a full-blown crisis and I need to go to the hospital. And so this one time I went to the ER and I got there and I was there in the waiting room for over an hour without any pain meds, without any fluids, nothing. And I have a fighter mom. Don't mess with my mother. Yeah, she fights. So she fought for me and made sure that I got my fluids and I got my painkillers. Very few people have someone who's there to advocate for them if you're unable to. Because imagine, I'm in so much pain that sometimes it gets to a point where I kind of lose myself. Like I'm not here. Like my brain just turns off and it just focuses on the pain and everything else around me is just blurred out. So it's important to have someone with you who advocates for you to make sure that you're getting your meds, your fluids, everything that you need. So for me, that was one of many experiences that I've had with the healthcare system. So it's really important as a patient to advocate for yourself. If you know that you're supposed to receive X amount of fluids, make sure that you get that amount of fluids. Or in a case where you need a blood transfusion, then you make sure that you make all of these things known, because sometimes some of these doctors, I've been in a situation where some of the doctors don't know what to do or how to manage you. So sometimes you could actually advocate for yourself and say, this is what I need, and this is, and just guide them on how to manage your case. Okay, so the next question is mental and emotional well-being. How do you cope with the emotional and mental challenges that come with living with sickle cell? Are there any support systems or activities that have been particularly beneficial for your mental health? I have a very supportive family. I think that's my biggest support that I could say I have right now, my family. I've had some battles where I have faced by myself because I feel like I was burdening my family. There's sometimes when you live with a chronic illness, there's a certain level of feeling or thinking that you're burdening people next to you. So you would rather just deal with it by yourself. So sometimes I wake up and I know I'm not supposed to question God, but I'm human. And I sit there and I ask God, why me? Why did you give me this disease? Why am I struggling like this? Because sometimes the pain gets to you to a point where you're just like, there's been times when I've prayed to God and said, just take me. Let me rest. I'm tired. I've had those days. And I remember one time my uncle came to visit and I was really unwell. There was a time I used to even carry an oxygen tank and mask to school because I couldn't breathe on my own. So one time he came to visit and I was really sick and I was laying there in bed and I was just exhausted. I was tired. And I told my uncle, I said, please pray to God to take my life. Just allow him to make me rest. And my uncle looked at me and he said to me, if it's time, you will rest. But if it's not time, then you will keep on living. But for now, I want you to keep fighting. So it's words like that will have you keep fighting and wake up every day and be like, I know it hurts and it's too much and I'm tired. But you just have that one uncle, that one sister that will just tell you, keep fighting. I love you. I don't want to lose you. Keep fighting. So you keep fighting. So for me, my mental well-being, my support system is my family. That is my biggest support system that I have. And I would say my mother has really strengthened my prayer life. I find that when I'm in a situation where I feel the pressure is too much and it's getting to my head and I'm just in a point of, I would say depression, I just gather the strength and just pray. And the minute I say amen, I'm just a whole different person. So I think God has been my biggest rock, and my mother has strengthened me and made me this person who's just a prayer warrior. So yeah, I fight most of my battles on my knees. Advocacy and awareness. Have you been involved in any advocacy or awareness efforts for sickle cell disease? Can you tell us about your experiences? What do you think are the most significant misconceptions about sickle cell disease that you'd like to see addressed? Okay, so I started advocating for sickle cell in 2019. That was during the period of COVID. I decided to share my story with the world on my Facebook page, and that video went viral. And so many people were asking me questions and wanting to do interviews and whatnot. And I realized in that moment that my voice and my story matters. And so many people that I know personally sent me a message saying, hey, I'm also struggling with sickle cell. And I'll be like, I had no idea you had sickle cell. You know, there's so many people who are living with sickle cell and struggling in silence that see me as someone they can open up to and speak to, and just have a person that in times when they're struggling, they can come to me and speak to me. So I think that was a moment for me when I realized that it's really important for me to add my voice to the people that are raising awareness. So I joined an organization called Zansava. That's Zambia Network for Amplified Voices in Advocacy. So I've been doing advocacy work with them here in Zambia, and we've done a few advocacy works. Right now, we're working on going to the rural areas of Zambia where people don't really know about sickle cell, because the biggest misconception that you hear is that sickle cell is because it's a spiritual thing, like it's witchcraft. So you want to really educate people as much as possible. So for me, that is my biggest passion, speaking more about it, educating people, making sure people know exactly how sickle cell comes about, how you manage it, and if there's any cures out there. Just the more we educate, the more we speak about it, the more people know about it. I remember with HIV, it was the same thing. No one really knew about HIV and AIDS, but the more they spoke about it, the more they raised awareness for it. Now the whole world knows about it, and now there's even like advanced treatments for it. So we hope to reach a level where people now know about sickle cell and know how to manage it very well. The next question is personal insights and growth. How has living with sickle cell disease shaped your perspective on life and resilience? What personal strengths have you discovered or developed as a result of living with this condition? There's one word I hear a lot. If you ask anyone that knows me to describe me in one word, I can guarantee you that 70% of them will say, Natasha is strong. Like, strong is the word that people use to describe me. There's so many things that I have faced in this life that maybe some people wouldn't be able to handle it, but I just have built this resilience where I don't give up. Giving up is not in my blood unless the situation forces me to. And that's when I've tried every avenue and I've failed. That's when I will stop and I'll give up. But giving up is not in my blood. So living with sickle cell, you have to have a certain level of resilience because you will face a lot of stigma, especially when you speak about it openly like me. You open yourself to a lot of negative criticism, positive criticism. So you have to be able to take in the negatives and the positives. For a young woman like me who's still single, the prospects even get less because people are like, oh my gosh, I don't want to associate myself with this person or whatnot. So it just shapes you as a human being because it teaches you how to love yourself. You have to love yourself to a level where you just know that you deserve good things. You deserve all the good things life has to offer. So yeah, sickle cell has really changed my perspective on life, and the fact that I live a fulfilling life and I can do anything really that anyone else can do. I always say, sickle cell doesn't run my life. I run my life. So I have friends who tell me, oh, you can't be doing that. In the past years, I've been a very adventurous person. Like, I'll go zip lining and doing all those things, and those are things that will trigger a crisis. And I'm like, I'm doing it, and I've done quite a few of those scary things, And I find some of my friends who are also sickle cell warriors would be like, oh, you're not supposed to do that. You're going to trigger a crisis. But for me, it's all about I have lived the life on my own terms, and I'm not going to let sickle cell dictate to me what to do with my life. So yeah, I would say I have definitely discovered very interesting things about myself from living with sickle cell. The next question is talking about my future aspirations. What are your hopes and aspirations for the future, both personally and in terms of advancements in sickle cell treatments? If you could give one piece of advice to a young, newly diagnosed sickle cell disease patient, what would it be? My hopes and aspirations for the future. Well, I have a lot. But one that comes to the top of my head is I hope to touch as many lives as I can, to reach out to as many people as I can. I think I'm very passionate about working with people and just being empathetic towards other people and sharing my story with as many people as I can. And I hope to one day have the tools and resources to help kids living with sickle cell disease that are unable to get medication because it's too expensive, or can get good health care. Those are some of the things that I really, really want for my future. And hopefully to get married someday. I mean, who wouldn't want to get married, right? Yes, so if you could give one piece of advice to a young person newly diagnosed with sickle cell, what would it be? Sickle cell is not a death sentence. it is not a death sentence. You can live a healthy, happy life. In my church, we always say this thing where, they say God is good, and we answer, just look at me. So I'll say the same thing to you. Just look at me. I'm living a healthy, happy life, and with sickle cell, and I am not limited by sickle cell. So don't limit yourself. Dream big, follow your dreams. If you want to be a doctor, go be a doctor. You want to be a lawyer, you can be anything you want to be. Never let anyone tell you that you're different or that you cannot do something, because you can. You are fearfully and wonderfully made in God's image. Yeah, that is my story. And I hope I inspired someone today. I hope I touched someone's life today. If you would like to hear more of my stories, you could find me on Facebook. It's Tasha Kashito. And I'm happy to answer any of your questions. No question is too personal, by the way. As long as it's sickle cell related, I'll answer it. So please bring in those questions, and let's see how best we can help each other. If you have a sickle cell warrior that you're living with at home and they're struggling, reach out to me and let's see how best we can help each other. It's always easier to have someone who understands what you're going through. So I hope you guys enjoyed my story. I hope we interact more, and God bless.